Hello, everyone, and welcome to our Mother's Health podcast, where we turn statistics into stories and voices into change. Today's episode is titled Sepsis and Silence, Maternal Infections and the Role of Clinics in South Sudan. Sepsis, the body's extreme reaction to infection, is one of the leading killers of mothers worldwide. But in affected places like South Sudan, where healthcare systems are fragile, as you can imagine, the threat is even greater. Now, sepsis often arises from untreated postpartum infections, unsafe abortions, or poorly managed deliveries. Globally, it contributes to 11% of maternal deaths, according to WHO 2020. In South Sudan, infections thrive because of limited antibiotics. As you can imagine, it's a war region, shortages of skilled staff, and lack of sanitation. So put this in context, I'm going to share a few stories. These are real stories. This is in Yama's story. And Yama is a 30-year-old mother of 5. She gave birth during the flood in Jogel State. This is a local clinic and had no sterile gloves or antibiotics. She developed fever, abdominal pain, but died within 48 hours of sepsis. And her husband said she gave life, but no one could save her. And then we have Asha's survivor. Asha is 22 years old. She gave birth in rural health post. The instruments were not sterilized at all. She developed infection, worsening fever, and only after reaching a UN-supported hospital in Juba did she survive. But she now lives with chronic pelvic pain. I asked why I was getting worse, but no one had answers. Asha recalls. These are but a few stories. I'm sure there are lots of stories out there on sepsis, and the statistics are devastating. But I'm glad I have a special guest with me today, and that will help me to unravel some of these death statistics to help us understand why sepsis is still a major killer, and what are the contributors, risk factors, and how can we address these issues. So we have here Professor Osaro Erhabor. He's a professor of hematology and blood transfusion science with extensive experience across Africa and Europe. He holds a PhD in immunohematology from Rivers State University, Nigeria, and has trained extensively in the UK and United States. He is currently with the Blood Science Department at Royal Bolton Hospital NHS Trust. He's a chartered scientist, examiner, and fellow of multiple professional bodies. A published author of books, journal articles. He serves as an editor-in-chief of the Sokoto Journal Medical Laboratory Science. His research spans infectious disease, transfusion medicine, hematology, and quality management. So it's one of the best people that I thought could throw insight or bring insight into as a problem. You're welcome to the podcast, Professor Osaro.
Thank you, Dr. Vivian, for having me.
Thank you. So thank you for being here. So we'll go straight into the podcast. I'll just ask you a few questions because I want to know more about sepsis. Now, from your own medical expertise and experience, your wealth of knowledge, you tell us what is maternal sepsis?
Okay, sepsis is a serious complication of bacterial infection that develops and spreads to the bloodstream, eventually affecting tissues and organs. These bacterial infections are pneumonia, urinary tract infection causing and group A streptococcus. What happens is that when this bacterial infection spreads to vital tissues and organs in the body's immune system, in a bid to fight that infection, begin to destroy the tissues and the organs, and leading to shock, leading to multi-organ failure, and eventually death. It is a life-threatening emergency. It's a silent killer, and it is a major public health issue. It can occur during pregnancy, during delivery, or postpartum. Postpartum means after delivery, up to about 42 days or 6 weeks after delivery. About 5.7 million cases of maternal sepsis occur annually globally. Of this number, about 261,000 women die needlessly from complications of maternal sepsis. For every 1,000 births, 11 experience infection-related complications, organ dysfunction, and eventual death. And the most worrying aspect about maternal sepsis is that 85% of cases of sepsis and associated death occur in low and medium income countries. So it's quite a devastating problem.
Quite a huge number.
Yeah.
And imagine what happened in war regions like South Sudan.
Oh, it can be worse.
Yeah. It's even worse in those regions.
Yeah.
Thank you for that introduction. So we'll just move a little further. I'm going to ask you, what are the risk factors associated with maternal sepsis?
There are several risk factors associated with maternal sepsis. One is urinary tract infection. If there's a presence of a urinary tract infection, the tendency of the infection to ascend through the birth canal and potentially cause sepsis is high. If there has been trauma to the abdominal wall or the perineum, either delivery or during a cesarean section, is also a risk factor. It can also occur as a complication of miscarriage. Miscarriages, abortion, particularly unsafe abortion that thrives in most low-income countries of the world. A woman that also has had a surgical operation, a CS, or that has had a traumatic delivery, and the chances of those surgical site being infected by bacteria is also very high. In women that have had premature rupture of membrane, what we call breaking of the water, look up if there has been a premature rupture of the membrane that has lasted up to 36 hours before the baby is born. It also can predispose the woman to risk of maternal sepsis. Women who have had forceps or vacuum delivery are also prone. Women who big babies and in the course of delivering those babies have a tear, or the doctors have to do what we call an episiotomy, give the woman a nick so that the baby can through the birth canal easily. All those are all predisposing factors. Unhygienic conditions, like you see in most developing countries, and lack of access to sterile equipment and environment can potentially predispose a woman to maternal sepsis. Women who have had prolonged labor, those that have gestational diabetes, women who have retained placenta, and infections also being introduced when there are manual procedures, particularly when those procedures are not done in a hygienic environment. All this can potentially predispose these women to maternal sepsis.
Thank you very much for that. It's really enlightening to know all of this in depth, because I know that definitely people out there, maybe nursing students or healthcare practitioners. I was just having with another, and she's a lot. We're talking about child traditional and misinformation, and she shared how the state of healthcare is in many developing countries and also in Nigeria, and how in very few skilled birth attendants, and maybe some people may just supplement to care of these women that are not even necessarily experienced. So this is very good, because it will help to bring enlightenment to people like that, because unfortunately a lot of women find themselves in situation where they have to have people that are not very to do those sort of work, unfortunately, because the lack of facilities and care. So hopefully this will help to bring that sort of enlightenment to people like that are more training and knowledge about sepsis and how to prevent maternal deaths. Now we'll talk about something else. It is very vital. Okay, investigate the potential source of infection, because sometimes it can be difficult to tell where this is, or the sepsis is, or the origin of the sepsis. So can you help us to also talk about this as well?
When obstetricians suspect a woman is having sepsis, there are a number of, it is very important that we investigate the potential sources of the infection. And we know that the origin of sepsis is bacterial infection.
Yeah.
And it is very important to think of the 6 potential origin or sources, what we call the 6 Ws. The first one is the womb. The doctors will have to look out for signs of infections of the womb. If the womb is tender and the woman has abdominal pain and she's having a foul-smelling vaginal discharge, it may mean that there's potential infection of the womb. We also look at weaning. Weaning has to do with breastfeeding.
Okay.
Doctors have to look out for, or healthcare workers will need to look out for signs of mastitis. Mastitis, inflammation of the breast and a red area in the breast, accompanied with a flu-like symptoms. You understand? They also need to look out for signs of breast abscess. Then also look at the wound, what we call the wound, particularly for women who have had a cesarean section, women who have had a tear during delivery, women who have had an episiotomy during delivery. You also have to rule out the chances that those sites have become infected. And what we do is that we look out for signs of discharge from the wound. We look at the surrounding skin to the wound. To look out for things like reddish and painful skin around. Then we also look at what we call water. Water has to do with urine, passage of urine.
Yeah.
We have to look out for signs of urinary tract infection. Check the urine to see if it is unclear and cloudy, or if it is bloody urine. Those are all signs of potential sepsis. We also look at what we call the wind, breathing of the woman.
Okay.
If the woman is presenting with she's breathless, you understand, the respiratory is high, she's hypotensive, all this can also potentially be signs that she may have sepsis. And also the 6th one is what we call wings. For women who are in malaria endemic countries, like in sub-Saharan Africa, it is also very critical that we test those women for malaria and treat them effectively and promptly for malaria, for those who are positive for malaria.
Thank you so much. I just can't help but think about, that have just had their babies. So are these all the things that they need to check just after they've had their babies to ensure that there are no sepsis? Also, their duration, they need to check for all of these signs.
If a woman is pregnant and she is having any of these symptoms, she should consult a healthcare worker.
Okay, what about after pregnancy?
After pregnancy, sepsis, postpartum sepsis can still happen up to 42 days after delivery or 6 weeks after delivery. So that period is still a significantly challenging, delicate period. And if a woman has any of these signs and symptoms that we've talked about, it is critical that she seek medical help as soon as possible.
Thank you so much, Professor Erhabor. Okay. I'm going to ask another question. This is why women, okay, this is very common in developing countries. I can imagine why, but why are women in developing countries dying from this preventable condition? Okay, what's happening? We know all of these things. We know the consequences of sepsis. We know that these women should be checked. So why is this still a problem? And we also understand in war regions like South Sudan that, okay, it's a war situation. So, but in countries like Africa, why is this still a problem when it's preventable?
Yeah, like I said earlier, 85% of all cases of maternal sepsis and associated mortality happens in low-income and middle-income countries.
Yeah.
There are several factors that drive this infection in developing countries. One is that there's limited access to quality prenatal care in most developing countries. Another factor is that there's delay delay in recognizing and treating this infection. If there is a delay in treating this infection, the chances of being able to treat woman effectively is reduced. You also find out that there are weak, in most developing countries, the healthcare infrastructures are weak. There's we challenges with brain drain, a significant number of healthcare that should be providing quality healthcare service for people in these low-income settings. Because of hardship in those countries, look for greener pastures in most developed countries. And find out that you have very few healthcare workers left to look after the needs of people in these developing countries. Another issue is the issue of inadequate infection control practices are often downplayed in many of these developing countries, mostly because they are not there. You look at weak maternal health surveillance and emergency response system. Ideally, if a woman goes to a primary healthcare center and it is identified that she be having symptoms of sepsis, that woman should promptly be referred to the secondary and potentially the tertiary health facilities where she can be adequately managed. But these emergency response systems are weak in many of these developing countries. You also find out that there are restrictive reproductive health policies in many of these developing countries. You have lack of access to broad antibiotic treatment. You also have the challenge of adulterated fake antibiotics in of these developing countries. So most of these women buy these antibiotics with the hope that they're buying genuine drugs, not knowing that they're buying fake products. And that just compromises the of these women. Then you also have the lack of skilled health workers, particularly birth attendants. In rural settings, local villages, government should be able to train traditional birth attendants, practices in managing these women, particularly those who don't have access to services and delivery services. And these women should be able to look after these women. And when they encounter cases that they feel is beyond their they should be able to refer those cases to upwards to the secondary and tertiary health facilities. So these are some of the reasons why a lot of women in developing countries die needlessly from complication of maternal sepsis. When you have the right tools, it's difficult to manage, and particularly when you have you identify, diagnose and you have access to quality broad spectrum antibiotics. These women shouldn't be dying.
Yeah, but a lot of them are giving birth in traditional birth homes. And a lot of times there's no access to, because all you're mentioning here is something that is found in a healthcare setting. But if people are giving birth in these homes or local settings, it's very, very to manage sepsis. It will be very, very to identify the problem, first of all, and then even more difficult to address it. And sometimes it remains, there's a delay, like you said, into appropriate facilities to deal with the situation, and before you know, also gone. So can you also enlighten us on some of the common signs and symptoms of sepsis? So what should people be looking out for when give birth or women are pregnant, because we are focusing on maternal care right now?
Yeah, a number of common symptoms that women should look for. If a woman is having slurred speech or confusion, either during pregnancy or post-delivery, is having extreme or pain, if she's having anuria, passing no urine in a day, they are all signs. If she's severe breathlessness, if she has a smelling vagina that was not there previously, if she had discolored skin, rash and spotty skin, if a woman has a sore throat or suspected chest infection and she's having productive cough, is a sign that she may be having sepsis. If she's having headache, flu-like symptoms, she's having chill, she's having fever, inability to pass urine or urinating more often, or having a burning sensation when she's passing urine. These are all potential and symptoms. If she's having abdominal or pelvic pain that is tender to touch, you understand? If she's having a sudden increase in vaginal bleeding, particularly postnatally, all the signs a woman should look out for. And when you see any of these signs, it is critical that she seek medical help and attention.
Yeah. Thanks for pointing all this up. So if you have any of the symptoms and in a medical setting where they've not recognized it, you can also speak up for yourself quickly to say, these are the symptoms I'm having. These are the signs of sepsis, because that's why we're doing this podcast, to bring education to women as well. If you not feel well, you see some of these symptoms, then you need to speak up to healthcare provider as soon as possible. I've been discussing with a lot of people on the podcast. A woman tried to use herbs, local herbs, to try to prevent postpartum hemorrhage. And this is unbelievable. So when you have these symptoms, speak with healthcare provider as quickly as possible. So how do we, Professor Erhabor, how do we diagnose maternal sepsis? I know that these symptoms are there, but we need to also diagnose them properly. How we do this so that we can also educate some of these local hospitals, settings, know how to do this.
Like we said earlier, if you have any of these signs and symptoms, it is critical that you use medical help. There are a number of blood tests that can be carried out that can potentially help diagnose maternal sepsis. Some simple tests like a full blood count that can be done in most secondary health facilities, even in developing countries. You have things like C-reactive protein, procalcitonin. These are all lactate tests. These are all laboratory tests that can be carried out to determine if there is an infection in the system. Doctors should also check for signs of vaginal discharge. You can do what we call a blood to identify whether there is bacterial infection in the bloodstream. There are also tests that can be done to assess organ function, like the renal function test for the kidney, liver function test to monitor how your liver is functioning, glucose tests. All these can also potentially help us to make diagnosis. You can also do what we call clotting or coagulation test. Prothrombin time, activated partial thromboplastin time can also be of help. Then you can also do things like chest X-ray, CT scan to identify any that have potentially been affected, to evaluate the organ status. All these can potentially, and I'm sure majority of this can be done in most secondary and tertiary health facilities.
Exactly.
In some of these countries. You may not find this in primary healthcare centers, but if a high index of suspicion, that is why it is critical that these women are promptly referred to the secondary or tertiary health facilities where these tests can be effectively carried out and the diagnosis can be made, and these women can be treated effectively in a timely manner. And by so doing, we can prevent them from dying needlessly from maternal sepsis.
Yeah. I'm glad you prevent women from dying from maternal sepsis. So how can we do that? In summary, what can we do to prevent maternal sepsis?
There are a number of things we can do to prevent maternal sepsis. One is simple, is to reduce the risk of developing infection by just practicing good hygiene, like washing your hands before and after changing your sanitary pad or touching your vagina, cleaning your delivery practices, hygiene, such as having daily shower, can potentially, maternity changes, and making sure that if you have had a CS, you have had an episiotomy, you have had a tear during your delivery, that those wounds are kept clean and dry. And that can help contamination by bacteria. It's also very critical that women pregnant attend antenatal clinic regularly and they take all their protective vaccinations, all this can all potentially help them prevent coming with sepsis.
Thank you very much. As you know, one of the ways women contract. So, what are the challenges with unsafe abortions? And I also like to mention we have a full episode on unsafe abortions. This episode 5. So we all head over there to get more insight on unsafe abortion, how it's affecting women in developing country, because obviously it's legalized. So a lot of people doing a lot of quack abortions, a lot of young teenage girls doing a lot of quack abortions. So tell us what the challenges with unsafe abortion as it regards to sepsis.
Post-abortal sepsis is a major cause of mortality of young women and girls, particularly in developing countries. You know that a woman dies every 8 minutes from complication of unsafe abortion, either as a result of post-abortal sepsis, hemorrhage, or perforation, uterine perforation. Unsafe abortion is a common cause of sepsis-related deaths in many young women in developing countries. We have that about 42 million women who have unintended pregnancy opt for abortion yearly. And of this number, 20 million of them, the abortion is unsafe.
Yeah.
So estimate that women, about 13% of women die from unsafe abortion annually. And what is unsafe abortion? Unsafe abortion is the termination of unintended pregnancy by an individual lacking the necessary skills and license. Abortion that is carried out outside a formal healthcare setting. So when an abortion takes place in a non-healthcare setting by a non-licensed or qualified practitioner, that abortion is unsafe. And the chances of that woman dying from post-abortal sepsis is significantly high. Evidence has shown that unsafe abortion has increased significantly from 44% in 1995 to 48% in 2003. And it is a big problem.
Yeah.
Ironically, in developed countries where abortion is legal, where women have access to contraceptives, the abortion rate is significantly lower compared to what you have in developing countries where you have all kinds of restrictive abortion laws, less access to contraceptives. The rate of unsafe abortion is significantly higher in those issues that we need to, and there are several factors that drives this unsafe abortion in developing countries. One is legal restrictions. The second of access to contraceptive.
Yeah.
That drive a lot of these young women to take this dangerous alternative of having an unsafe termination of pregnancy. You also have the issue of cultural and religious stigma, associated with lack of access to safe and legal abortion services like you have in most developed countries. And because these abortions are unsafe, a lot of these women develop complications, and for fear of legal repercussion, fear of stigma, they don't show in hospital and they don't open up to healthcare practitioners. And by so doing, they die needlessly from this post-abortal sepsis.
Yeah, that is so educative. A lot of content in this podcast. I hope we're the right message to the right people, especially in sub-Saharan Africa, for education and teaching and for learning. So what are those factors that drive maternal sepsis in developing countries?
There are factors that drive these most developing countries. We have talked about access kids, maternal health care. We have talked about the lack of infection control, prevention, and standards. We have talked about the fact that there's suboptimal number of traditional birth attendants to look after these women. We have talked about infrastructural challenges. We've talked about lack of education of these young and women There are factors that can, you also have access to family planning and contraception. All these are factors that potentially drive the cases of sepsis in most of these developing countries.
Yeah. That tells we need a multi approach to tackle this problem. It's not just a linear approach to we need to include a lot of factors when we are tackling sepsis, maternal sepsis, especially developing countries. So maybe can use this multi approach that required, multifaceted approach that is required to tackle maternal sepsis.
The challenge maternal sepsis require a multifaceted approach that involves improving access to skilled maternal health care, enforcing infection prevention, expanding family planning services, reforming a number of the restrictive abortion laws to prioritize women's rights. You agree that every woman, regardless of where she lives, deserves a safe childbirth and reproductive autonomy. So a number of multifaceted approach is required to with the structural and systemic issues and barriers that we have in many of these developing countries, bordering on suboptimal healthcare infrastructure, shortage of trained health personnel, and the challenge of brain drain, poor access to planning and contraception, restrictive abortion laws and policies that we have in many of these developing countries, and the lack of trained traditional birth attendants, particularly in primary healthcare settings. All these are that we need to add. There's also need to enhance the access to quality maternal healthcare services at all levels, both the primary, secondary, and tertiary health facilities. There's need to provide and expand access to contraception to prevent unwanted pregnancy and to reduce the risk of unsafe abortion. There's need to implement effective infection prevention and control measures in many of these developing countries. We also have the challenge of microbial resistance. Because of the use of antibiotics in many of these developing countries, a lot of these bacterial strains are becoming resistant to majority of the antibiotics that are available to manage these women with maternal sepsis. There's also need to liberalize restrictive abortion laws. There's no worthwhile criminalizing abortion in this developing. What just happened that you drive these women to take these deadly alternatives. There's need for trained and licensed practitioners to be allowed to carry out safe abortion, like we have in developed countries, using any of the prescribed methods. Public enlightenment is also very important, targeting the members of the public, religious leaders, on the need to create national awareness aimed at reducing all the cultural, social stigma and religious hindrances that are associated with the promulgation of liberal abortion laws. There's also need for significant investment and accountability by government in many of these developing countries. Government should be responsible, for the sexual of their. It's also very important that we have post-abortion family planning counseling, so that these women who have had this unsafe abortion, they can take right contraceptive and will not need to go through the process again and put their life. Reproductive health education should be included. I think it should be included in the school curriculum, particularly for young girls in developing countries. There's also need for appropriate antibiotic use and the development of new antimicrobial agents because of the growing resistance of most bacterial strains that we are finding today to readily available antimicrobial agent. It is critical that more research is to develop more antibiotics that can be used to manage these women. Very importantly, political will, adequate investment required to that women's health in developing countries are enhanced and to enable us this needless death, countless number of women who who, for no fault of theirs, happen to be residing in a developing country. Government, it is the responsibility of government to ensure that these women are looked after, and we can reduce the chances of women dying from maternal sepsis.
Yeah. Thank you very much, Professor. This is a comprehensive teaching outlet on the podcast. I'm sure a lot of people will benefit from everything you said here today concerning maternal sepsis. I would like to say sepsis may be silent, but it is not inevitable. With stronger clinics, better supplies, more awareness, mothers in South and Sub-African countries, and even in war regions like South Sudan and across the globe can survive childbirth. Yeah. And I believe, and you've also said, every mother deserves safe, and bringing the rate of sepsis down, the death rate, will significantly improve maternal outcomes for women and also the death rate across the world. So thank you very much for coming on the podcast, Professor Erhabor. Any final and conclusion before we go?
In conclusion, I just want to say that government in developing have a duty of care to ensure that women in this conceive this best possible standard maternal and postpartum care that they deserve, like their counterpart in the developed world. It does not cost too much to provide this infrastructure that is required to manage pregnant women safely and effectively. And it's just the political way to have it done. The cost of one SUV that is provided for an average politician can go a long way in training thousands of traditional birth attendants.
Exactly.
In many of these countries. So there's no, the countries can get it right first time and all the time with managing, looking after pregnant and ensuring that they have decent quality maternal care and postpartum care that every woman deserves. Thank you.
Thank you. So for everyone watching, if you're a healthcare practitioner, have experience in maternal, please come to the podcast to share your insight. If you have new standard of operation or technology you want to share, or things that you have implemented in your own practice that have worked, come on the podcast to share with us. For all the women watching all over the world, take heed. And from all of these things we've said today, send your email, come share your stories with me at OMH podcast. I'm going to leave it on the screen at gmail.com. Thank you so much and have a good day. Bye-bye.
Bye.
Thank you for watching our Mother's Health podcast today. Remember, every mother deserves safe birth. Bye-bye.